Good afternoon, guys. It's Dr. Matthew Marcotte. Hopefully everybody is having a nice weekend. I want to share with you some information on vaccinations that I didn't realize a lot of people didn't know. I was talking with a friend of mine yesterday and going over a couple key terms about vaccinations and why people should understand those terms. And she had no clue about the terms and when she had made decisions to vaccinate or not. So I was like, wow, I should probably shed some light on when somebody makes a decision to vaccinate their child or not, that they should know the key terms. So let me explain. There's two key terms. One is the word attenuated. The other word that we're going to speak about is an adjuvant. So attenuated means changed, or in this case, we're talking about viruses, rendering them inactive. So a little history about when vaccinations first came about. They used live viruses, or lack of a better word, live viruses. They would use a very, very small amount, and that small amount would be enough to create an immune reaction, and that immune system in your body would be able to mount a defense and antibodies, and then create immunization for the future exposures, which was great. But what happened was sometimes the immune system did not win, and the person would in fact get the virus or the disease. In this case, many people got polio who should have never got polio. So they found quickly that there needs to be a better answer. So they figured out how to attenuate the virus, meaning like make it inactive, so it'd be weakened. So awesome, love it. So fast forward to today, like most of our vaccinations, if not all, are attenuated, which is great because we don't have those side effects. The problem, what they noticed was the effectiveness of the vaccines were weak. They weren't being very effective. And the reason for that is because your immune system is not going to mount a defense as well as it would for a live virus compared to an attenuated virus, because our immune system is way smarter than we are. So it recognizes it as not a problem, and it won't create antibodies, which in order for a vaccine to work, you need to have an immune system to react to create antibodies. So we got a problem. So what did they come up with? We got to make it effective. We're not going to use live viruses anymore. So they're like, well, we're going to use an adjuvant. That's the key term, second key term, an adjuvant. What is an adjuvant, you ask? Well, an adjuvant agitates things, pisses off things. So, well, there's certain adjuvants that they know that piss off the immune system really well. And guess what that is? Mercury and aluminum. They're both neurotoxins. Yes, you do not want to inject this into your bloodstream. It's different when you digest any aluminum. There's a barrier in your gut. Whereas when you inject it right into your bloodstream, there's a whole other reaction. What happens was, though, if they give you enough aluminum when they inject the virus, you piss off that immune system, you create a hypersensitive immune response, and then you have a built immunity now to react to that attenuated virus. Are you guys following me, I hope, now? So, great, it worked. Now we got an immune reaction. We built a defense. Awesome. Now what happens with the pissed off immune system to a developing baby that doesn't have an immune system fully developed in the first place? Adverse side reactions is what happens, people. This is why you'll see the allergies skyrocketing across the world, especially here in America. and you see autism skyrocketing, and you see ADHD skyrocketing, is because you're giving these vaccines to undeveloped immune systems and nervous systems. What other reaction are you going to get when you directly piss off a system that hasn't developed? You created hyperreactivity in the immune system, and if it's not developed yet, there's a lot of adverse side effects that no one will know and won't be able to tell because it's such a developed system and it's so young. So I just wanted to guys share with you what those two words mean and why they even add an adjuvant in there, i.e. aluminum in a vaccine, or why they use attenuated virus versus live viruses. So I hope this helps you guys understand more about making decisions, or at least just understanding why something has to happen or be added to create an effect. All right, guys, sign off. Take care. God bless.